Hello class, my name is JB and I will be doing my presentation on sensory deprivation tank therapy. The student learning objectives for my presentation: upon completion of this presentation, students should be able to understand what sensory deprivation tank therapy is and what it is used for, understand the mechanisms of sensory deprivation tank therapy, and analyze and interpret the effectiveness of sensory deprivation tank therapy. Sensory deprivation tank therapy. What is it? A sensory deprivation tank, also known as a float tank, contains a foot or less of water and 800 pounds, over 6 pounds of salt per gallon of Epsom salt or magnesium sulfate. There's so much salt is intended and aimed to promote flotation of the body. The first tank was designed in 1954 by John C. Lilly, an American physician and neuroscientist. He designed the tank to study the origins of consciousness by cutting off all external stimuli. The sensory deprivation tank therapy is also known as REST, which is restricted environmental stimulus therapy, sometimes referred to as flotation rest. And here are a few pictures of different flotation tanks and devices. As you can see, some are open to the internal environment of the room, and some have lids that can close and cover you as you set your body inside. What is this therapy and treatment used for? Sensory deprivation tanks are said to have many health benefits, including inducing a clear and empty state of mind, improving focus and concentration, and promoting an overall state of relaxation. Sensory deprivation tanks are also known to provide muscle relaxation, lower anxiety, and improve depression. Other benefits include improving sleep patterns, decreasing pain, and improving a sense of well-being. How this works: the air that surrounds the tank is set at skin temperature and the room is dark and soundproof. The water also is set at skin temperature, and as the name denotes, the tank was designated or designed to induce a state of sensory deprivation. So while you float in this tank, since you're floating a tank and not touching anything, there's no sound or light, your senses are deprived because there's no stimuli. The float experience is calibrated so that the sensory signals from visual, auditory, olfactory, which is smell, gustatory, thermal, tactile, vestibular, gravitational, and proprioceptive channels are minimized. And since those are minimized, movement and speech is also minimized while you're in this tank. So while you're in this tank, it basically cuts off all senses by suspending you in warm water. The efficiency of sensory deprivation tank therapy. In one of the studies I found, it was a short study. It involved 50 students or study participants, and all of these participants had a range of anxiety and stress-related disorders. But the test included a 160-minute session in a sensory deprivation tank. Measures of self-reported effect were calculated immediately before and after the hour float session, with the primary outcome measuring being the pre to post float change score in the Spielberg State Anxiety Inventory. So they were asking questions based on this score, and they were asking these questions before and after the 1 hour session. Irrespective of diagnosis, flotation rest substantially reduced state anxiety. Moreover, participants reported significant reductions in stress, muscle tension, pain, depression, and negative affect, accompanied by a significant improvement in mood characterized by increases in serenity, relaxation, happiness, and overall well-being. So just in this 1 hour therapy, these 50 participants showed an improvement in their outlook and their stress and anxiety. And in the second study that I found, which included 65 participants, 14 of which were men, 51 were women, they were randomized into a control group or a flotation tank treatment group. So one didn't receive the treatment of the tank, and the others did. And they participated in a 7-week flotation program with a total of 12 flotation sessions. And the way they measured the effects of this, questionnaires were used, questionnaires measuring psychological variables such as stress and energy, depression and anxiety, optimism, pain, stress, sleep quality, mindfulness, and degree of altered states of consciousness were used. Stress, depression, anxiety, and worse pain were significantly decreased, whereas optimism, sleep qualities significantly increased for the flotation rest group. It said also for the control group that didn't undergo the rest, no significant signs or changes were detected in that group. There's also a significant correlation between mindfulness in daily life and degree of altered states of consciousness during the relaxation in the flotation tank. So this study showed that constant use over a few weeks helped with their anxiety and stress, and also with sleep qualities and other ailments that they had. Some side effect, or a side effect that I found, mainly the only one, was that it may induce hallucinations. A 2015 study divided 46 people into 2 groups based on how prone they were to hallucinations. So there's a group who were highly prone to hallucinations, and another group had a low prone tolerance to hallucinations. And researchers found that sensory deprivation induced similar experiences in both the high and low prone groups, and it increased the frequency of hallucinations in those high prone groups. So over the years, studies have shown that doing this type of treatment may induce psychosis-like experiences. And here's a little picture. I don't know if you guys watch Stranger Things, but they do a little, although it's a fiction show, they do a little their own type of man-made sensory deprivation tank, as you can see here. And although there's only that one side effect, there is a few people who I think, or who are said to kind of stay away from this type of therapy, and those who should avoid this type of therapy are those who have epileptic seizures, particularly if the seizures are not well controlled by medication, people who are under the influence of drugs or alcohol, anyone with an infectious disease. Just because you're in the water and people might be coming in after you, you don't want to be spreading that disease. A person with open skin wounds, and I think that's because of the high salt content in the water. It probably wouldn't feel too comfortable to have open wounds. And anyone who has thoughts of suicide, like I said before, since it may induce hallucinations, that could have a negative effect on someone who might have thoughts of suicide. And that will conclude my presentation. Thank you, class, and be safe through these hard times. Thank you.